So far, over 750 million doses of the COVID-19 vaccine have been distributed across the country, according to the CDC. That's just 2 years after a COVID-19 task force was created to plan its rollout. Dr. Anita Patel designed and oversaw the distribution plan at the CDC. She's also a finalist for a Service to America Award. Anita, welcome to the program.
Great, thanks so much for having me.
So when you were charged with leading this effort, a vaccine wasn't even available yet. How did you start planning the rollout for it?
So this was a pretty complicated mission that was very large in scale. The very first thing we needed to do is make sure that we had the right people at the table. This was a mission where we had to ensure that we had the right level of expertise, people that understood that multiple things had to go right in order to successfully be able to deliver vaccines and be able to get shots into arms.
And this was the biggest vaccination distribution ever for the federal government. I wonder what challenges you faced because of the scale of that distribution and how you addressed them.
Absolutely. So this was, as you said, the largest vaccine campaign in U.S. history for both adults and now pediatric vaccines. We needed to make sure that we had an entire system in place. So this meant that we had the right type of product, that product was delivered in the right place at the right time with the right guidance for use, and that we did everything in our power to ensure that we were removing all barriers to access. So whether that meant transportation, the costs associated with the vaccine, and ensuring that everyone who needed and wanted to get vaccinated had actual access. The biggest component of this response was definitely the private-public partnerships that we had in place. Our partnerships with, of course, our state and local health departments, as well as a whole new initiative to ensure that we had private sector expertise to help augment what we knew was going to be a massive response. So this included everything from our data partners to our distribution and our logistics partnerships, and of course our large-scale pharmacy partnerships, which ended up being the largest arm within the vaccine mission.
I wanted to ask you a little bit more about that because, as you said, this was really the first of its kind public-private partnership, not just with the national pharmacies, but also with local pharmacies to get the vaccine distributed. Tell us a little bit more about how that worked.
Absolutely. So the Federal Retail Pharmacy Program was designed to be able to ensure that we provided access as close to the communities who wanted to be vaccinated as possible. Our healthcare infrastructure isn't necessarily built in a way that ensures total access and easy access to individuals. However, pharmacies are positioned in a way that they're about a 5-mile radius from 90% of the population. So the goal of the program was not only to include the large pharmacy partners, the ones that we all know and hear about all the time, but also some of the smaller partners. We've got places in rural America in the center of the country where if we don't have these partnerships in place, access couldn't be there. So it was critical for us to not only have the large pharmacy chains, but also what we called the network partners, where we brought in independent pharmacies and smaller community pharmacies to ensure that we had reach within the communities all across the country.
And the CDC collected data from the local agencies and pharmacies on the vaccine effort. What was that data that you collected, and how did it support the effort?
Absolutely. So data for action was absolutely a critical component for this response. We needed to ensure two things: that we had, first, a line of sight for all the product. What that means is we needed to know where all the product was at all times. So we had all of the data coming in from when the product left the warehouses, when it got to our distributors, when it got to our state and local partners, as well as our pharmacy partners, and what was happening at the site in terms of the amount of inventory that was available. So that is the stuff that we needed to make sure that we understood where it was at all times to ensure that we had good stewardship and good use of the federal assets that was so critical and life-saving. On the back end, we also needed to know who it was that got vaccinated. It ensured that we understood how the country was moving along with the vaccination campaign, who was being protected, and most importantly, where our risks were and where additional efforts were needed for outreach to ensure that people knew that vaccines were available, and most importantly, that they were safe and effective. That data included demographic information for individuals to understand age, race, ethnicity, which was a critical component of this response, given that COVID has disproportionately impacted select population groups. We also wanted to know the zip codes, so this allowed us to understand the vulnerabilities within the communities, and again, shift our operations, our guidance, to ensure that we were reaching and communicating directly with individuals who needed to get vaccinated or who wanted vaccines.
So what would you say was the greatest challenge your team faced?
Our greatest challenge was also our greatest success. It was this incredibly large partnerships and the people that we had to bring in for this all-of-government effort. As I mentioned, this was a huge private-public partnership, but it was also ensuring that we didn't look at the problem the same way, which meant that we had to have new lenses at the table. This allowed us to look at the problem differently, not be beholden to old ways of doing things, and really be creative in how to ensure that we were taking on this huge mission to ensure that vaccines were made available to those in the United States that wanted to be vaccinated.
All right. Well, Anita, it's a pleasure to talk to you, and thank you so much for your work on behalf of that vaccine rollout.
Great. Thank you so much for having me.
Thanks for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.